Hi, everybody. Welcome to our latest panel on big data visualization. I'm Chad Blair, politics and opinion editor with Honolulu Civil Beat. I'm here live on Zoom from Kaimuki in our offices. I can see Palolo Valley to my left. And it's great to see everybody that's joined in here today for this latest episode of the Hawaii Book and Music Festival. We're talking about a subject that's very important given the state of the internet, given the state of our ability or inability to communicate with each other across various channels. And I'm very fortunate to introduce our guest. And even though you've heard their bios, I'm going to tell you what they are again. That's Dr. Erin Hughey. She is director of PDC Global Operations. It leads enterprise data programs and global response operations for the center. And Erin may explain a little bit more about that when we speak with her. Victoria Fan is interim director of and associate professor the Center on Aging at the University of Hawaii at Mānoa, and also the author of a terrific community voice piece that ran not long ago on our Civil Beat pages, in which you wrote about what it's like to move away and yet feel an obligation to come back and help Hawaii. And then Nick Redding is the executive director of the Hawaii Data Collaborative, a nonprofit organization focused on making meaning. I hope I read that right, Nick. You can correct me if I'm wrong. Making meaning from data for solving Hawaii's pressing challenges.
Well, good afternoon to everybody. Thank you so much for having me here. The topic of big data and operationalizing big data is really important and near and dear to my heart. The Pacific Disaster Center is actually here on Maui. We have a global mission. If you're not familiar with us, we're actually an applied research center under the University of Hawaii that first came about after Hurricane Iniki, when government and really Senator Inouye realized that there was all of this data, all of this technology, all of this information out there, but it was in the hands of the military or private sector and not getting to civil society. So my focus really is, how do we take this diverse data landscape and create action with it? So the first thing that I want to really highlight today is some of the unique ways that we're leveraging data to save lives and reduce losses, and to understand that Hawaii has a huge role globally in bringing data and bringing big data and visualizing that big data to a global market. So if you haven't already downloaded your Disaster Alert app, which is free, it will provide you global coverage on hazards that are happening everywhere. But most of us realize that we are not experts in tsunamis. We're not experts in hurricanes. We're not experts in flooding. And that's why our focus really has been to take these thousands of different data streams and translate them into actionable risk intelligence. And really, what I'm trying to answer for the world with big data is, what happened? Where did it happen? How bad is it? And what do I need to do about it? Because if we have an answer to those 4 questions, we are on our way to advancing and making sure that we're protecting lives and reducing overall losses. But to do that, it's a complex process. We have to have extensive understanding of risk and vulnerability. And we're doing this at all different levels. So we're doing it at a global level, a national level, a subnational level, and even here in Hawaii at a hazard-specific island level with the Kilauea eruption risk assessment. From there, PDC will join this really important risk and vulnerability data that consists of socioeconomic conditions, things that are unique and culturally important that really set the tone for a community. And then we combined it with our all hazards impact model data. Now, what do you need to know about this? I'm not going to go into the back end. I promised I would never do that. But what we're able to do is derive, if this event happens, what's the likelihood of how many people will be impacted, how many households? What does that population look like? Do we have a lot of children, a lot of elderly, so that any type of emergency response can have the right resources to bring to bear? And then we're also able to translate that in the US using FEMA guidelines to tell you how much food, water, shelter, refuse you might need. But then internationally, we're able to do that working with our partners at UNOCHA and World Food Program, so that the larger international community can have agreed upon numbers for how much food, water, shelter, because it really does take a team effort to get this mobilized.
Of course, in 2020, early 2020, we were already anticipating that coronavirus, COVID, would be a major impact to our economy. And as 2020, 21 unfolded, so many news reports, Civil Beat, all sorts of reports about the gaps in the data for COVID. And I think it fundamentally revealed, the great interest that the public has in data, but more so than ever before, I felt that the public was demanding to know more about health data and the real-time health situation and response. In this kind of crisis or situation, I like to use this Chinese word, weiji, which is a combination of two different words. One is danger, right? The danger of the coronavirus, the danger of us using fax machines, for example, for contact tracing, but also an opportunity to try to do something better to address and resolve this crisis. And so I was fortunate working together with Hawaii Data Collaborative and many other organizations. We launched what is called the Hawaii Pandemic Applied Modeling work group. Please check out our website, www.haipam.org. We have our COVID-19 forecast, which was launched last July. This is just one case, one sort of use case or example of this data visualization on a relatively regular basis. This is, I think, pulled from yesterday about the immediate forecast of what we think COVID will be in the next coming weeks, next 2 weeks, actually. And even something as simple as presenting a 2-week forecast might seem, innocuous or simple, but we learned over the course of this whole pandemic experience that even the projection of what we think the pandemic will be can cause tremendous confusion and misunderstanding. And we saw, in the case of other modelers and forecasters, people projecting out 2 to 3 months for the COVID situation, which oftentimes had so much to do with human behavior and policy. And so HiPAM took an approach where we would only forecast out 2 weeks in advance, recognizing that anything after that would be subject to change of human behavior and policies and all sorts of other factors. But this sort of particular case is just to illustrate, one example of how data can be visualized. And I didn't want to show you all these other examples where, pandemic forecasting kind of went awry to some extent. If you Google it, you'll see so many cases where the forecast was used to justify certain policy actions or decisions without necessarily being aware that that forecast was not accurate at all because of the fact that, unlike hurricane forecasting or natural disaster forecasting, where human behavior doesn't necessarily immediately change the forecast, COVID forecasting is very susceptible to human behavior. And that part, I think, for us in the COVID forecasting and modeling world was, I think, one of the hardest pieces to communicate to policymakers. Even now we get asked, HiPAM gets asked, what's COVID going to be in 2 to 3 months? And we could give you, a rough estimate based on what we know today is the situation, but the science is constantly evolving, vaccine efficacy is evolving, people's willingness to wear masks, whether we change the restaurant restrictions, everything is constantly changing all the time. Makes it so hard to do this type of work. And I think as my colleague, Professor Monique Shiba says, we're sort of still in the dark ages with regards to epidemic forecasting. We're still just very, very early days. But, we've got a lot to learn still. But, I think COVID and this pandemic emergency revealed, I think, a lot of the challenges that were already present. And, stress tested is the engineering word, I guess you could say. But with COVID, it was much more surge tested, right? Because the cases would just surge very rapidly. And, you could maybe organize these challenges in a couple of buckets. Resources. Is it a lack of money? Perhaps why we had these challenges, or maybe it's a lack of capacity that we had these challenges, or a lack of leadership. And the final result is why things did or did not get done. Why did we still have fax machines in 2020, right? So, my personal view is that rarely, certainly in the, let's say, high income country state of the world, rarely is it a lack of resources. We have plenty of resources to go about, even with COVID federal funding. So many resources yet to be spent. Okay, we'll just leave it at that. So it's not a lack of resources or money, but what about capacity? Okay, I put this as a black circle, it's a black box. What do we mean by capacity? And in my view, again, this is my personal experience about what we mean by capacity. As someone at the university, this is fundamentally about workforce capacity. Are our employees and staff able to do all this data stuff, all this amazing data stuff that Dr. Hughey just mentioned, right? And for me, this workforce capacity, and I'd love to hear, Dr. Hughey, your perspective about what these categories are. But for me, these 4 critical buckets of skills or capacities are: 1, administrative; 2, technical and IT; 3, the analytic piece of it; and 4 is teamwork and communications. And I guess maybe, Dr. you'd also maybe add in the policy piece as well, being able to communicate to policymakers, which is a great maybe addition to this piece. But administrative is things like, how do I purchase an IT system? Okay, that requires procurement, navigating your bureaucracy. Technical and IT would be, the actual IT system, your database system, your software systems. The analytic piece is, thinking through the question that you actually want to answer, understanding the importance of the data that you're interested in. And then finally, the communication piece is also very, I think, much embedded with the teamwork, working across disciplines, under pressure, lack of time, sometimes lack of resources to get this all done. And in some sense, this may seem like a lot, but I still think that this is doable. And maybe that's because I'm in a university and we train students to do all this kind of stuff. And so I'm very optimistic this is also not so much a lack of capacity. Here's where, so, even in our typical analytics frameworks, this kind of reflects what Dr. Hughey was mentioning. There's this process of discovery where you're inventorying and planning and requesting all these different data sources. There's this process of cleaning data. You have to look at the quality of it. It's very, very tedious to clean all the data. Analyzing it is the next step, transforming it, calculating it, formatting it. And then finally that communication piece, putting it into data files or reports or whatever format it is that's needed. And again, I still think this is all within the realm of possibility and very much doable. And again, I don't think this is where the bottleneck is. What I think my personal view after the last almost 2 years is I believe it's an issue of leadership, and where does leadership fit in with data? And I was just, maybe this was more of a therapeutic process for me, but I really believe leadership can serve as a catalyst for change. And in the absence of leadership, the amount of energy required to change a system is enormous. And the cost to change are so high that change never happens. Again, back to the case of the fax machines with the contact tracing, decades passed and the fax machines continued. There was a lack of leadership to some extent to transform that into a modern system. And with leadership, there still is a hump, but it's possible. Change can happen. Okay, so what does leadership actually mean? In my view, I think everyone, if you take a leadership training course, everyone's got their own definition of leadership, but I really think leadership is a catalyst. So for me, leadership to get to the next stage of data visualization and health data for the state of Hawaii, we would really need a vision. We have to be able to see what needs to be changed rather than trying to reinforce the status quo, which I think oftentimes managers are just trying to keep things humming and just do the same thing. Trying to not find excuses or rather, I've met so many people where sometimes it's a litany of excuses why they can't do something, right? Leadership also requires courage, ability to do things which may seem extremely challenging or impossible or daunting. And then finally, leadership also requires an ability to reflect on your weaknesses, knowing that you are not going to have all of the administrative, IT, analytic, communications, and policy experience. You need to build that team together in order to produce that, in the end, that very simple and beautiful diagram that Dr. Hughey, presented is, I'm sure, so much work to just get to that final stage, right? So this, I think, is actually my final slide, and I really believe the future of health data, and maybe all the data in Hawaii, really requires a stronger leadership. And it's this leadership which will help to catalyze the growth of these capacities in the end, in order to get stuff done. The GSD factor, as my colleague Eddie Mercer likes to say, the success. And without that, it will be the opposite of it, which is failure. And I think in some areas we really had severe failure.
Perspective I bring is from supporting those responding, supporting the data needs of those responding to the pandemic in particular. And of course, this was the disease itself. We got to work with Victoria on a lot of things related to that, but also other data issues around how do we understand the economic shock, and particularly the impact on households. And when I think about our topic, I'm actually not going to talk a lot about big data and visualization itself, because I think there are three things that we can think about to help us realize the fuller potential of big data and how that would serve the people of Hawaii. And so, first of all, the pandemic has hopefully changed how we all think about data. Data sharing, I think, has never been more critical for addressing many of our pressing challenges. And I'd like us to start thinking about how to bring these perspectives that we've gained, not just to the acute shocks that we face, the stuff that Erin and team are very good at helping us address, but some of the chronic challenges we're faced with. When we think about, how the pandemic changed how all of us see the big picture of data, that the data itself helps us understand what's going on and why, which then informs the decisions to the outcomes we achieve. And like Victoria said, when have we seen so much interest in data, so much demand for good quality, timely data? COVID data was important to all of us to understand what was going on and what needed to be done, holding those to account that we entrusted to help us get through this. Everybody had a stake in the outcomes. And my hope is that this experience can kind of put a wedge in it, and that's kind of related to my question of Victoria about health data systems. This can be a wedge that keeps the importance of data at the forefront, and to the challenges we face on everything else going forward. Data sharing has never been more critical. Shared problem solving necessitates sharing data and shared meaning making at the core. Data helps us all ensure we're talking about the same thing and measuring ourselves against the same thing as well. And our data systems should serve this purpose. And of course, there's a role for state data. The timely data is often there, and we don't get to it. It's easy to point blame, and there's lots of good reason and lots of capacity and leadership challenges, as we all observe. And I would love to see us work on that and find strategies to work on that. But I would hate for the agencies to become the scapegoats for our broader data challenges. Reliance on government data does have limitations, including the timeliness and adaptiveness of collection and reporting. So we shouldn't stop there as the reason we don't have the data we need. I think we need to start to think about what the enabling mechanisms are for data sharing for global insight. What we think about a lot is how can we gain global insight from those closest to the issues of interest and the data that's collected there. I think about a health data analog to that is the syndromic surveillance, where, at the patient provider contact level, symptoms are observed, but we also gain benefit from the aggregation of that for public health experts to be able to start to see trends and patterns that are emerging that would give insight to what might be coming and help us get prepared for that. What if we started to think that way about other touch points to many of the challenges that we're faced with here in Hawaii? There's roles for intermediaries to enable that, whether it's funders, state agencies, nonprofits like the Hawaii Data Collaborative, et cetera. How do we support those at the work to be able to share through data their insights up and roll that up into helping us all understand what's going on and having that perspective in a timely way. One chronic challenge in particular that's getting a lot of attention now and was getting a lot of attention before is that of families that are on the economic margin. ALICE is often the term that's evoked for that, which is a term coined by United Way, it's an acronym of Asset Limited Income Constrained Employed. And it's a framework that many of us have come to use to talk about families that aren't in poverty, where we do have a lot more data and lots of programs to help those folks, but those that are on the margin, those that are one financial event, one missed paycheck away from falling into poverty. We were talking a lot about that before the pandemic. And then of course, natural questions came. If that was already at 42% before the pandemic, where is it now with this sudden economic shock? What we didn't talk about is the fact that we have that global number because of census data that lags by 1 to 2 years in terms of the reporting and the analysis of that. And so we were left with very little understanding of how families were faring post-pandemic. And even now, as leaders talk about this being an issue, and I'm seeing lately, ALICE is higher than ever. It's higher post-pandemic. The truth is we actually don't have data on that. We actually don't have data to help us understand that. It's probably true, but we don't have that global metric, and we don't have a lot of the data we would need to drill down on that to understand who, where, what. As federal funds have flowed in and we put them to work, has that worked? Has that helped? As we think about how to spend down the rest, where do we put it? Where's the help needed? So listening to Erin's talk, I kind of commented on this as, I would love to have that challenge. I would love to have this, so much information about how households are faring that we actually have to reduce the complexity of that so decision makers could have a clear sense of who's struggling with what, where, and how we could be helpful. Right now, there's a disconnect between this very data-driven and robust high-level metric and the data we actually need to understand how that's evolving and what we can do to help that. So to summarize, I'm excited that we're all talking about data differently. That's good. Data matters, and when we don't have it, we're not able to respond effectively to pressing challenges. Data almost always has broader utility than where it sits, and the extent to which we're able to connect through data will enable all of us to engage in more effective action. And our data systems, for especially the issues I've been talking about, have never really supported addressing chronic challenges. The pandemic has just made that more apparent. So if any of what I'm talking about is interesting to folks, just the landscape of data, we took an interest in this at the end of 2020, wanting to reflect on our own experience and helping others get the data they needed and translate that into evidence that they could use to support the decisions they could make about the work that they do. We brought our own experience to this, and we also interviewed 30-some stakeholders, did some other stuff to really gain a sense of how a lot of thought leaders in Hawaii were thinking about data, the potential of data, the challenges and opportunities. If that's interesting to you, I encourage you to check out our data landscape report. And then also, just not to take up airtime, we aren't just, I'm not just calling out that we don't have timely data about household need, we're working to do things about that. And so if that's interesting to you, we also encourage you to check that out at our website, dataforneed, hawaiidata.org.